Greetings, I'm Dr. Damien, your Chief Wellness Warrior, and we have got to talk about it. Yes, pain is one of the worst epidemics that is continually growing, where we're seeing more and more people are suffering from chronic and persistent pain, even though we've got all these treatments, medications, modalities, and surgeries and injections out there. So, what do we do? Because you, the rehab warrior, physical therapists, PTAs, occupational therapists, CODAs, nurses, physicians. We're all out here with skills and tools to help improve pain, and yet people are still suffering. Here's what the research shows is that how we approach pain and how we engage with our patients as it regards pain can make a profound difference on their healing journey. So, I want to share with you three ways that you can improve your approach today to help your patients really get to the point of conquering their chronic pain. All right. So, the first way is really understanding that pain is a gift. And I know it sounds crazy, and you can tell your patients that, and they're going to look at you crazy. But the reality is, pain is a gift from your brain to you, your soul, your spirit, your consciousness, connecting you to what's going on in your body. You see, your brain is there to protect you, and it protects you by giving you warning signs. And pain is one of those greatest warning signs. Now, when we look at it that way, then we understand why pain is so valuable. Could you imagine walking around and stepping on glass and rusty nails and all kinds of things and not being able to feel it? What danger would that put you in? You would be at a high risk for having infections and wounds. And I mean, let's face it, you probably wouldn't live very long if that were the case. So let's learn how to honor the experience of pain and really appreciate the fact that it is simply your body trying to help support you, right? And when we come to that place, then it helps our patients to understand that they can't avoid pain, that we have to learn how to engage with pain in a way that's going to help reduce it and bring back life the way we want to live it. So we build on that in the second way that you can really improve how your patients experience pain, and more particularly, how you, the clinician, are approaching pain. So the second point is we have to also understand that pain can highlight damage. Yes, an injury, an accident, something traumatic happens inside or outside. But pain can also signify sensitivity. That's a big distinction. And the chances are what pain you're feeling and what pain your patients are feeling is likely pointing more towards sensitivity. 75% of the time, the pain our patients are feeling is more a sign of sensitivity than it is of any lasting or reoccurring damage. I mean, take for instance our patients who have had a surgery. They wake up out of surgery, maybe they've had a rotator cuff repaired, they're in a sling, and there's obviously no damage that can happen from them moving their fingers. And yet the pain ramps up. Their nervous system is extremely sensitive, and it's our job to help them understand that and honor that. And just getting to the point of understanding that and appreciating that reality can help to reduce their pain on the spot. There's a lot of power in really understanding how we think about pain and how we are processing that pain. This is the beauty of really looking at this experience through the biopsychosocial model. And the third point that I really want to make is probably the most important for clinicians because we know the physiology and the anatomy, we know the neurological implications. We have all those things. We've been trained in that, and we know our treatments can be effective. But when we really look at it, we have to understand that some of our patients just aren't ready. They're just not ready. When we find patients and clients who are in that pre-contemplative space, they're in that stage where it doesn't matter what exercises you show them, what medications you give them, what recommendations you give to them, they're not in a mind frame or a mindset where they can actually appreciate those changes and those influences on their pain. And it's a tough thing to say. It may even sound harsh, like I'm denying that people can get better, but that's not it. What I'm saying is it's important for us as clinicians to have a better understanding of what our patients are going through, what processes are happening, and what stages they're in when it comes to initiating and really pushing through behavioral change, and what that means for our care that we're providing and for their healing journey. So it's important to see your patients, listen to them, honor their feelings, and let them feel what they need to feel instead of trying to move ourselves away from that discomfort of seeing them in the space and the stage that they're in. So learn more about what the phases of behavioral change are and really grow in how you perceive your patient's experiences so that you connect with them on a better, deeper level, can actually give them what they need in that moment. Because a lot of times, the medication, the exercise don't really get to the root of what that person needs in that moment to either begin or progress through their own personal journey. So, to recap, I want you to make sure that you can honor the reality of pain and the gift of pain. That's number one. And number two is that understanding and sharing with your patients and clients that yes, pain can highlight danger or damage, but in most cases, it's a sensitivity that is really at the root of the severity and discomfort that they're feeling. And that can sometimes put your patients at ease. And then three, we want to honor the stage that your person, your patient, and your client might be in that moment. Maybe they're just not particularly ready for the treatment you had in mind. Work together, let them know that you see them, validate what they're going through, and ask them what they need right now. I hope this serves you and I hope this speaks to your practice. Let me know. I know that this has been, a central part of my own clinical journey, working with my patients, and it is my mission and my joy to really help other clinicians to really grow into being their best selves, not just in the clinic, but in the lives that they want to lead. And so, with that, I'm welcoming you and any rehab warrior who wants to go on a journey to really grow in their own clinical practice, their own health and wellness, and just find some more excitement and a spark for the work and the life that we lead. So, I'm excited that right now in this part of our journey, I'm welcoming only three more individual clinicians into the Willpower Warrior program. This is an opportunity to specifically learn some new skills and tools to take right back to your clinic. This is a way that we can continue to explore different ways of showing up for our patients, for our families, and for ourselves in a way that really brings back the spark to pain, to really grow and live the life that we want to live. I am so excited to get started with more clinicians and bring them into their own personalized concierge style willpower warrior experience. You'll gain so much insight about your own journey. We'll work on your career planning so that you can live the life you want to live, corporate and personal. And you'll gain 16 credit hours for your license if you're a physical therapy or occupational therapy professional. There are personal and group experiences that I can tell you will absolutely change your whole outlook, your mindset, and your appreciation for living and working in this space. I'm excited to welcome you. And if you have questions about this, please go onto my website, thewillpowerwellness.com, and book a free wellness check in so that we can talk about it. Let's see if this would be a good fit for you, or answer questions about some of the things that we talked about today on how we can approach our patients in a better way so that we can show up as our best selves for the betterment of our families, our patients, and our communities. I'm Dr. Damon, your Chief Wellness Warrior. If this speaks to you, like, comment, share, and I look forward to working with you soon. Be well.